Advocate, and today I have the pleasure of interviewing a colleague of mine. Her name is Dr. Lamontanaro, and she is a clinical psychologist, and she is going to grace us with her presence today on the CJ Cares podcast. Welcome to the podcast.
Thank you very much. It's wonderful to be here.
Thank you. Now, Dr. Lamontanaro, I like to ask a few rapid questions to see how you will respond.
Sure.
So let me just go ahead and get into it. Were you team Android or you team Apple?
I'm an Apple lover, yes.
Okay. And what would you say is your favorite destination trip, like for vacation?
Well, on my wish list is Italy. Half Italian and I've never been there, so I really want to go.
Yes, definitely. That's likewise. I would love to get to Italy. I've heard so many good things. And I know, like, I consider healthcare workers to be superheroes. And I think every superhero needs a theme song, right? So if you had a theme song for yourself, what do you think it would be?
I don't know. The theme song of Rocky just came to my mind. I don't know, somehow when you said that, so I'll go with that.
Okay, all right. I like that. That's a good theme song, you know. That means you might win the war.
Yes, I hope so.
Definitely. And I wanted to ask you, if you had to sit down with someone for dinner that's notable, you know, who would that person be?
Oh, wow. Well, I'm a big fan of Sigmund Freud. He kind of started me off in my career being in love with his theories and his writing, so I would have to say Dr. Freud would be my first choice.
All right, that's awesome. Now, at what point did you know that you wanted to be a psychologist?
Well, I actually knew very young. I was maybe about 11 or 12. And my dad, who had an interest in psychoanalytic theory, and I would talk about our dreams and interpret our dreams. And he would have been made a great analyst. He was a chemist, but I think that started me off in having an interest in the field. And I pretty much said I want to be a psychologist one day when I was maybe about 11 or 12.
Okay, and where did you go to grad school and things of that nature?
So I did my undergrad at Rutgers, Douglas College, the women's school at Rutgers, and then I did a master's degree first at Queens College. Coming out of college, I wasn't sure whether I wanted to go into clinical psychology or neuropsychology. So I did the master's program, and during that master's, I realized I really wanted to be a clinical psychologist. And then I got into Furkhoff Graduate School, which is part of the Albert Einstein College of Medicine. It's their clinical psychology doctoral program.
That's awesome. Now, I realized upon doing some research, I know that this is, you know, we're in the times of COVID, and a lot of other ailments have gone by the wayside, so to speak, attention-wise.
Yes.
I think that an issue related to sexual abuse is still one of the largest ailments that a lot of people suffer from.
Yes.
And I wanted to ask you a series of questions. How would you treat a patient who does have sexual abuse history?
Well, and that's actually a topic near and dear to my heart. I've definitely developed an interest and a subspecialty in working with survivors. And, you know, the approach, I mean, there's so many, we're talking about a whole spectrum of issues, from somebody who may have been raped on one end, and it might be a one-time issue, versus somebody with a complex trauma history of abuse, you know, throughout childhood. So it kind of depends, you know, on the patient and their history and what they're presenting and how they're presenting. But I think, you know, first of all, I'm a more in-depth, you know, clinician. I would always give that patient control, like to deal with the abuse directly or not deal with it yet. These are people whose control has been robbed from them. So it's very important for them to have control over how soon they get into it, how much they get into it. So I always give that space. And, you know, primarily I want to offer them first of all, a witness to what they've been through and an understanding of the complex emotions that might be involved. So, I mean, with some people, there could be like areas that they're stuck in their lives because of abuse. So we would be dealing with the abuse, but also current relationship issues that are being impacted. So there's so much to this topic. I could speak for hours on it, but that's some basics. But a trusting relationship with a therapist, I think, is the first and foremost order of business, like a good solid ground to start with.
Right. And I imagine that you have to coach them along some. How would you help your patients overcome emotional blocks that would negatively impact their relationships?
Right. So first of all, understanding the connection between their past history of abuse and their current struggle in their relationship. Some patients come in with that insight already. I had a call recently from a patient who said, I'm a new wife, and I have the sense that my history of sexual trauma is impeding intimacy with my husband. That's like an ideal scenario because the person already has that understanding. Some patients have to even create that link. They're not even aware that their current relationship problems and their trouble with closeness and intimacy has roots in their childhood. So, it kind of depends on where the person's at. You kind of have to listen to where they're at. Like I said, some people come in with that understanding, and they can really go from there. Others need to, understand that their past does link up with their current relationship. And then, of course, and once you're there and that connection is made, really looking at what the fear is about, like what the fear is about getting close. And it could be sexually close, it could be emotionally close, or both. And then helping them work through some of those fears and understand them and work through them.
Okay. Now, I noticed that you are also bilingual.
Yes.
Are you seeing trends among Spanish-speaking individuals of sexual abuse?
Well, actually, very much so. So here at NUMC, we do have, over the years, an increasingly large Central American population. And, for a long time, I've been seeing a lot of trauma, sexual trauma coming from immigrants from those areas. And I think there's a lot of complex reasons for that. There's a lot of gang violence in those areas, a lot of poverty, and laws that don't protect, especially women. I have been seeing a lot of severe sexual trauma from patients in those areas. There's not a lot of treatment for them, which is unfortunate.
Can you speak of any other barriers to treatment for sexual abuse amongst the Spanish-speaking population besides language? Better Life Associates. Their therapeutic practice enables them to offer effective outpatient, individualized psychological care. They treat a number of mental health disorders and provide a neutral ground to individuals, families, and couples. Their treatment focus is to help individuals and couples heal, reflect, and become more aware of their inner strengths. They achieve this by providing a neutral, safe space, listening to your concerns, and customizing a treatment plan. They promise to be there for you every step of your journey, and their goal is to help you grow from your struggles, heal from your pain, and move forward to where you want to be in life. If you are in need of these services, please contact Better Life Associates now. Language?
Yeah. Well, one is economic barriers. So many of the individuals are undocumented, so they don't have insurance and they don't have the means really to pay the kind of fees that most practitioners get or even clinics get. So I would say, besides language, economic barriers are very significant.
I imagine you treat patients who may have sexually abused someone. When treating these high-risk patients, are you fearful of them during the time you meet with them?
Well, I've worked much more with the victim rather than the perpetrator. Over the years, I have had patients that have mostly in the past have enacted abuse. And we've understood that these are patients that were not currently having the impulse to abuse, but feeling a lot of guilt about what they did. And in many times, those people themselves had been victimized. I see that more with male patients that have survived sexual abuse, sometimes have enacted abuse, and certainly I've known female patients that have done that. So so with those kinds of patients with that history, they have to deal with what happened to them. So you can see that they're enacting abuse as a way of trying to, in a very dysfunctional way, master what happened to them that they were not able to deal with or symbolize or speak with anybody about and understand.
Welcome to Line 3 Bikes. Line 3 Bikes is in the business of creating works of art inspired by and catering to the urban cycling lifestyle. Let Line 3 Bikes show you where creativity and innovation intersect. Get started on making your dream bike a reality.
Also wanted to ask you, are you seeing any trends in your field that's, related to, our current times?
Trends in what way? Tell me a little bit more.
Like, as a result of COVID, are you seeing an uptick?
There's a lot of trends related to COVID. One would be the telehealth has really taken off, obviously. Although I've been seeing patients through the pandemic, because not all patients have access to telehealth or smartphones and things like that. But the access of patients to treatment through audio-visual platforms, I would say, is that it's huge. And I think it's here to stay. I mean, it did exist before COVID, but now it's amplified so much that many patients, like in my practice, some people who thought they would never want to do something on an audio-visual platform now are never going to go back because they're so comfortable with it. So I think one of the silver linings of COVID is that insurance companies and the things have opened up to help people get more access to help.
What advice would you give to someone who's looking to enter the field of psychology?
Well, I would say to meet with people that are in the field. If you're interested in clinical psychology, find somebody to speak with. That could tell you what it was like for them, what the training involves, because often we don't know, in a field, like for example, in clinical psychology, when I first started out, I didn't realize that psychologists really learn about assessment. So, and that was something that appealed to me because, I had also been interested in the brain and neuropsych, but that wasn't something that I knew right off the bat, that as a psychologist, I wouldn't just be a therapist, I would also be somebody able to assess somebody's intellectual and their personality functioning. So I would just say, explore and learn. Any opportunity to speak with somebody in the field that could tell you about their experiences and what they do, to see if that lines up with your passions.
Now, I know you work a lot of hours helping a lot of people. What do you do to take care of yourself, to replenish yourself so that you can do such, good work here with your patients?
Thank you. But yes, I think that self-care and self-nurturance are very important for everybody, but especially people in the healthcare field, perhaps, especially in these times. I'm a big aficionado of yoga. I've been doing yoga for decades. I feel like it's kind of like, for me, a moving meditation. I have meditated at times, but I have to admit that I have not been doing a sitting meditation practice in some time. But yoga, kind of, I use it as a moving meditation. And I feel like it really nurtures my body, my spirit. I love the outdoors. I feel like the nature is a big, grounding force for me. So going for hikes, trying to have time to kind of put it aside and not dwell, because it's easy to take it with you. Over the years, I've learned, to try to not do that. That I feel like if I can recharge and re-energize myself, my free time, I'm a much better therapist.
Right. I just want to ask you one additional question. Now, people who have been sexually abused, they have to really get over the trauma of it. And in your opinion, you have seen many people be successful moving on from trauma?
Yes, absolutely. I've seen many people be successful in moving on. I mean, it doesn't mean that it's going to disappear, but what we hope for is that that person is going to be able to expand their lives and to have good people in their lives and healing experiences with healthy partners that will help put the trauma in a context, that it would be less dominating them. And it's always going to be there, but hopefully not to the extent where it's going to impede their ability to have a satisfying, happy life. And luckily I've seen, I've been able to witness people get there. Many, many people.
That's great. Well, Dr. Lamontanaro, I just want to thank you for coming on to CJ Care's podcast and answering some questions about your field of psychology. I think that, I've observed your work as you are actually doing work with patients, and some of the patients, were very, not on the easy side of things. And, but I think that the impact that you have on these individuals, I think that they will have lasting effects. And there's a lot of people in Nassau County that, are indebted to the services, that you provide. So I wanted to give you your kudos, for a job well done thus far. I know that it's not over now, but I know that the best is yet to come.
Oh, thank you so much. I really appreciate the opportunity to speak with you today. It was fun.
All right. Thank you so much, Dr. Lamontanaro, and we'd like to have you back in the future for future contributions.
I would love that.
All right. Thank you so much.
Okay.